Soma, are you ready? Are you on? Imat, can you please get Soma in case Soma is on?
Hello, everyone. Can you hear me?
Soma, are you on?
Yeah. Can you hear
Good.
me?
Yes, I can hear you well. Okay, let me share your presentation now. So, and then you will have 3 minutes to present what you want to say. You want to
Okay.
start now?
Yeah.
Okay, great.
Um, so, oh, sorry. So this is a case of post-operative instability after ACDR, a case discussion. So this was a 46-year-old male with a previous history of ACDF at C6-7 for radiculopathic symptoms. They were symptom-free for 5 years post-operatively, with, however, they came in with a new onset bilateral radiculopathic features due to adjacent level disease at C5-6 post-ACDF. Um, Given the frequency of adjacent level disease, we decided to contemplate C5-6 ACDR. And given the patient's young age, lack of myelopathy, and fusion across the facet joints, and lack of instability on dynamic imaging, this was further supported. He underwent C5-6 ACDR with the Secure C titanium plate ball and socket type, to which he responded very well post-operatively and was symptom-free for 2 months. However, after this, he developed further radiculopathic features in neck extension and came in with an antalgic flexed posture. His preoperative imaging did not show any instability, and we decided to remove the articular disc and replace it with an ACDF cage and a plate to promote the fusion. So below that writing, you can see some of the images that that were taken. So the first one, the MRI, is a 5-year post ACDF, showing the adjacent level disease at C5-6. The dynamic X-rays then show further that there's no instability. However, then the intraoperative X-rays show excessive gapping, suggesting some instability. Sorry. And then the lateral X-ray with the newly placed size 9 cage and plate at C5-6. So discussion-wise, so ACDR has been gaining favor in the last decade with a lower rate of adjacent level disease compared to ACDF. And it seems to do better in patients, younger patients, sorry, being under the age of 60. This patient seemed to fit the criteria. However, in hindsight, a larger size cage, that being the size 9, with a more anterior placement may have resulted in excessive widening of the disc space and diastasis of the facet joints, insufficient end plate coverage, or change of the axis by anterior placement of the disc, which would then lead to a less than ideal position, possibly leading to the iatrogenic instability, resulting in the recurring radiculopathic features. We present this case. This case is presented in order to highlight the importance of correctly sized artificial discs in order to prevent this post-operative complication. Thank you very much for listening. Any questions?
Thank you so much, Soma. It's you exactly fit with the time, and it was a very good presentation, and it was very
Thank you.
well and confidently presented. We will leave the questions for later, and
Okay.
now
Right.
thank you so much.